Kelsey, are you ready for bedside report?
Yep, I am.
Good morning, Mr. Smith.
Good morning.
Did you sleep well?
I think I did.
Good. Mr. Smith, I have your day shift nurse here with me. This is Kelsey, and I'm going to give her an update about what's been going on today, okay?
Okay.
Is it okay if we do bedside report?
That's fine. Hi, Kelsey.
Hi, Mr. Smith. How are you today? Good. I see over here you're a Gators fan.
I am.
Did you watch the game last night? They won, huh?
Mr. Smith, please feel free to chime in with any additional information, okay?
Okay.
So Kelsey, this is Mr. Smith. He's an 80-year-old male that was admitted by Northside IMS yesterday afternoon. Okay. His daughter brought him into the ER when she noticed he was having some confusion and a cough. In the ER, they did a urinalysis and he did test positive for a urinary tract infection. His chest x-ray was positive for pneumonia. So he is a core measure. He needs follow-up education session number 1. Mr. Smith, do you remember the follow-up education we did on pneumonia last night?
Yes.
Great. He is on a regular diet. His daughter Karen was concerned that he lost weight and was requesting boosts. So I've ordered a dietitian consult and they should be seeing him today. She is a care partner and that's her number listed on the board. Okay. It's also on the S-bar and I've also added it to the HOMES document.
Okay.
Mr. Smith has no known allergies. His only past medical history is hypertension. No AccuChecks, and you can see his abnormal white blood cell count on the S-bar. He is currently sitting 98% on room air. His vitals have stayed stable overnight. He's been afebrile and his heart rate has been regular. I did hear some wheezing. He is scheduled to get respiratory treatments today and they're still following him for incentive spirometry. He voids in the urinal. It's been cloudy and pink. He is a fall risk and therefore we have implemented fall risk measures. He has the yellow armband. He's wearing the yellow socks. Mr. Smith, I'll cover you right back up. The call don't fall poster is in the room and he has a falling star on his door.
Okay.
Mr. Smith, do you remember that you promised you would call me before getting up?
I did?
You sure did.
How do I do that again?
So on your call light, remember you have to press this red button.
This one button here?
Yes.
Okay.
Good. So Mr. Smith is pleasantly confused. He's only oriented to himself. He had a bowel movement last night, but other than that, no complaints of pain. He is scheduled to work with physical therapy today. His daughter was concerned. He uses a quad cane at home, but she's concerned he may need something more. She added this concern to the HOMES document yesterday, and I did notify the care coordinator of this need. His skin is clean, dry, and intact. He does have an IV on his right AC.
Let me see your IV real quick. Well, it looks great. It's not hurting you at all, is it? Okay, you let me know if it does, okay?
And he's also on oral Levaquin.
Okay.
He has Lovenox for VTE. Mr. Smith, do you remember that medication that helps prevent blood clots?
Yeah, it stings.
Yeah, it does sting a little bit. He is also scheduled for a follow-up chest x-ray this morning, and I have updated his board as well.
Hey Sarah, how did my dad do last night?
Hi Karen, he did very well overnight. We kept his bed alarm on and we did frequent vitals throughout the night to make sure he was safe. He is continuing getting his oral Levaquin today for the UTI and pneumonia. Based on your concerns when filling out the HOMES document, I did let physical therapy and care coordinator know, and they are consulted to see him today.
Okay, good. And there's another concern that I had for my dad.
Yeah, definitely.
He has trouble with his medications at home, keeping up with them. Sometimes he can't remember which ones he's already had for the day.
Oh, that's definitely a concern. I'll add this to the HOMES document right now, and then I'll talk with the care coordinator today and see if he qualifies for any home health services.
Okay, that'd be great.
Yeah.
Karen, this is Kelsey. She's going to be taking care of your dad today, and he's going to be in excellent hands. She's also from Florida, and she's a big Gators fan.
Yeah, go Gators.
All right, Mr. Smith, it was such a pleasure taking care of you tonight, and I'll see you later on today, okay?
Okay, thank you.
No problem. Kelsey, do you have any questions for me?
No, I think everything is good. So if you'll just give me a few minutes to talk with him before I go, and then we can go over the orders on the computer before you leave. Okay. So I'm gonna finish getting a report on my other patients, and I'll be back soon to discuss your plan for the day, and we'll update your whiteboard if there's anything else that needs to be done. Can I help you go to the restroom before you go?
No, I just went with the other lady. I'm just interested in watching the view.
Okay, well let's get you up and get you ready for breakfast, and then get you ready to watch the view. Let me turn off your bed alarm first. Hit that button. Ooh, look at these pretty bright socks. Gorgeous.
Oh, what's this?
That is a taps pad, and that's just to make sure that if you get up out of the chair that it will let us know, so you be sure to call us before you get up, okay? And it won't go off.
All right.
Okay, are you comfortable sitting in the chair?
Yes.
Do you have any pain?
No, ma'am.
Okay, let me get your call light real quick. If you need me before I get back, you hit that red button. Can you show me?
Right here.
Yeah,
right
you
there.
can show me how. That's great. So I'm gonna finish getting a report on my other patients, and then I'm going to come back with your medicines, and then we'll do your assessment and get you ready for the day. So you be sure to call me before you get out of the chair, okay?
I will.
Okay.